think it'd be great if you could share a little bit about your background and what you're doing at Bayer.
Sure, I would be happy to. Hi, everyone. I'm Padma Ayodhimani. I'm a software engineer by training. That's how I started in my career. But for the past 20 years, I've been working at the intersection of technology and healthcare. 15 years of that was at United Health Group on the payer side, and 5 years at Bayer in the digital health solution business. At Bayer, I have and continue to have the opportunity to work with an amazing team to build a digital health product for hospitals, healthcare institutions. It's a platform for AI applications for radiology. Throughout my career, I've been aware of the complexity of our US healthcare system and various stakeholders having different incentives. But it was not until my current role where I became acutely aware of how much this impacts and informs product strategy. So for my example of this radiology platform, we have several different stakeholders. If you think of a hospital system, the purchasing is informed by different departments. So we have our actual day-to-day users are radiologists, but they have other users, like the radiologists write a report and provide information to the clinicians who either order the tests or their emergency department where you get patients coming in for, say, stroke triage analysis. And then you have the actual patients themselves. But when you take the hospital system, you have the chief technology officer who wants to make sure that you have a software that is easy to install, implement, maintain, and is secure. So they do have different incentives and they're looking for different ROIs for the product. And then you have the providers themselves, right? They have different incentives. They want to make sure they can provide the best care for the patient without uh, any interruption to their workflow, their clinical workflow, and without unnecessary documentation and burden. And then you have the hospital system itself, where they need to stay afloat. They need to make sure they invest in the right technology that can help them provide quality outcome to the patient population while controlling costs and being profitable. Especially when you see that there are some community hospitals and smaller hospitals that are going bankrupt, this becomes very critical for them that ROI is an important factor in making any decisions they make for software. And again, there are disincentives also, right? When in adoption, when you look at it, where the hospital may be providing a certain service that is bringing them revenue, whereas a digital health innovation might be taking away that revenue by adopting that, right? So they do have to balance the needs of how this is going to work in the overall economic landscape of that particular solution that we are looking to adopt and for the ROI. So it's a very tricky situation. And then when you look at payers, right, and payers are key stakeholders, and this is unique in the business world. It typically a product is being sold by one company to one user, right, who is using it and paying for it. But in healthcare, the payers are hidden behind different layers, right? Patient may have some copay or other costs, but then the main payers are either the government, say taken Medicare or Medicaid, or you have the employers who are self-funding for their employee population, and then you have the self-funded health insurance companies. And generally, the incentive is to purchase products that provide the most quality for the least cost. But specifically, each of these payers have their own incentives and ROI that they're looking for, right? Health insurance companies, they want to make sure they have utilization management and they get quality ratings, right, for maintaining some of the Medicare and Medicaid payments. Employers are looking for predictable healthcare costs because their CFOs need to put aside a certain amount of money for every year for their patient population, for their employee population. And for them, the main motivation is business continuity. How do I ensure that I reduce absenteeism and we can have better outcomes? Hospital systems, as we said, want to be profitable. And at the heart of all is the patient, right? Who wants a certain health outcome that they want to achieve. And they want to be able to access it and afford it. And so that is their main incentive or the ROI on that is how much can how can I achieve this health outcome in a way that I don't go bankrupt? And so that's the incentives that you see and ROI that's needed to be proven for each of those stakeholders.
Well, thanks for sharing that overview. It's clearly a very complex consideration set. And so when you're thinking, in the product development space and the work that you're doing with all the different stakeholders, the payers, providers, the end user patient, the caregivers, how do you prioritize, um, you know, what the value is to them and what their ROI is? Because ROI doesn't necessarily have to be a dollar amount. It could be an experience or some other form of return that has value. So how do you, across the different stakeholders, how are you sort of prioritizing those different areas of value?
It's a great question, Amy. And if you think about, and you said rightly about incentives, not all of them can be quantified in terms of dollars or health outcomes. When you think of, the professions that have the highest suicide rates, doctors are other professions that have the highest suicide rates and the highest moral injury, right? So not everything can be, and the value of these providers and clinicians who provide to the society is very high. So the value, as you said, is not necessarily can be measured in terms of, X amount of hours saved, so many dollars saved, or so many procedures avoided. It's about, how much are you reducing burnout? What's the like an employee satisfaction score for hospitals, for how their providers, what's their well-being, and same thing for the patients, right? What's their quality of life? So there are so many other things that are intangible here. But I think there are also, ways that you can even talk about that intangible and ways. And when it comes to prioritization, right, I think the one of the critical tasks of a product management is to prioritize, right? We call that ruthless prioritization, and we always have, a lot of things that we want to build, but at the same time, we need to balance that with what is going to give us the maximum value, commercial value, right? I mean, there could be a value that we could be providing to a patient, but then as a business, it has to be balanced with what is commercially viable, right? So when you're doing that, it is important to look at the stakeholders and what is the ROI that they're looking for. So, for example, one approach to take that is to take a minimum value proposition exercise. A minimum value proposition is defined as the simplest version of a product that still provides value to the customer and validates the core assumptions. And each of these stakeholders would have a minimum value proposition, right? Because that's what shows that it provides value to them. And when you do these minimum value proposition exercises for multiple stakeholders and you put them all together, you can identify where you have the most overlap, right? And that is your priority. And that says, okay, this is the set of activities and features that I'm going to build for my product that's going to help provide the most value for multiple stakeholders and prove my product concept. If it's an initial stage or if you're ongoing and going to create more value through your product.
I think that's a great example of how you look at all the different stakeholders and what they're valuing, and how do you then ensure that you are delivering something that is going to work for the most number of stakeholders, while also ensuring that you're delivering for the company that you're working for as well. So you've got to kind of balance those things. I think that makes a lot of sense. Can you talk a little bit about ROI and benefit from a data and insight standpoint? We talked a little bit about, ROI isn't necessarily just about revenue. It could be reducing absenteeism and burnout, delivering better outcomes and better experiences. But from a data and insight standpoint, can you talk a little bit about how you can evaluate ROI from that standpoint?
Yes, I think what happens is most people are, when you want to solve a problem, you're really focused on what technology can I use to solve the problem and the product. And what we don't fail to we fail to see is that how are we going to demonstrate value to the person who's going to actually buy that, right? So I would say that, you have to look at where is the unit of value that is being consumed. At that point, what is the measure of that value? If it is measurable, it could be as simple as, as an automated prescription refill, right? The unit of value there is a time saved by the user. It's easily measurable at that point that, okay, the time it takes for you to go to a pharmacy, stand in line and get a prescription, whereas you have an automated refill that's get delivered to your door. And that's an easily trackable quantity that you could do. The most difficult to track is the outcomes, right? But what happens when you have better adherence to the treatment? And here the value to the payer is the adherence to the treatment by having this automated prescription refill feature, right? Because now it says, now the patient is always getting their steady supply of medicine. So we can have those treatment adherence because that's an important factor that we see in the healthcare landscape today, where patients are not adhering to treatment that could lead to more hospitalization. And so those are the types of value that at the point of consumption of the value, you track it and put that in a way that is consumable for the respective stakeholders. And I would give an example of, say, for example, you have an Aura Ring-like product that is going to measure your sleep and other biometrics. And you want to make sure that you are you provide the user with the charts and values and insights, right? So that's a more straightforward thing that you're saying, okay, here's your value. By doing this, you're able to find out, that you didn't sleep well on these days, right? Or your oxygen level dropped on these days. And so you're showing the value to them ROI on a continuous basis. And it is important because it is a very, from an engineering perspective, it becomes a very important decision of how you're going to store the data and how are you going to present the data, right? Because it's also like when you go to a grocery store and you have a checkout and they say, okay, you saved $25 today, right? By using your store card or whatever. So the value is being reinforced, right? So it's also talking about, okay, where am I going to track it, save it, and make it available to the stakeholders in a way that will make them want to continue to use your product, and it drives the value proposition home.
Yeah, that's great. And I think another good example. And you also shared a nice example earlier about when looking to prioritize the MVP approach that you use. Are there any other best practices you could share relative to making sure that as you're developing products, you are clearly thinking about the value to the end users or the intermediaries that will have to be involved to make sure that you're developing a solution that is truly solving for a real problem and not the other way around?
Yeah, so I was going to talk about the MSK offering, right? I think if some of you have already used these digital physical therapy offerings, these are offered by employers through your health plan. And I think it's a great example because the MVP there is, the service, from a patient's perspective, they want to make sure that there is a service equivalent to going to an inpatient physical therapist, right? Because when I go to inpatient to a physical therapist, I know that that person's going to make sure I'm doing it the right way. And that would then lead me to, do things the correct way and then get better and reduce pain. And and then for the employer, they want to have the same service equivalence because that is, and they want it to be scalable, available at a lower cost. And they want proof that it can reduce, say, absenteeism, and there is patient adoption and adherence, right? So you have these two MVPs, and the service equivalence is the common factor between the two in this example, right? So in this case, building a feature that tracks the patient's motion as you're doing the prescribed exercise through a camera, either the patient's own or the company provides it. It can help reinforce the value proposition to both the patient and the employer who's paying for it, right? Because the patient is now saying, okay, now I'm getting this something that's equivalent to being there because a machine is actually giving me feedback in real time. And then, you get the adherence information, right? And you can track that insight and provide that to the employer to say, for 90% of the time, every patient is able to follow along and do this the right way. And so, you're getting this. And there's so many other metrics that they could be reporting on. But that's one example that I would talk about that, it kind of, you building the right product and the right feature that incorporates the ROI and usability into the same concept.
Well, I think that's you've shared a number of really great examples and best practices that I think at the end of the day really tell the story of, as you are in the product development space, making sure that you are solving for the right problems, with the stakeholders and having them part of that process and understanding what is of value to them, and then developing for their needs as a way to really help better ensure the success of and the outcome that you're looking for. Well, Padma, thank you so much for your time. It was a pleasure talking with you. You're clearly an expert in the space, and hope to be able to speak to you again. I think your knowledge has been very valuable to our audience here. So thank you so much for your time.
Thank you, Amy. I appreciate the opportunity to share my knowledge. Have a good day, everyone.
Take care.